Welcome to Influential Women of Washington State. I'm Katie Hall. You are what you eat, and no one knows that better than Dr. Uma, pediatric gastroenterologist. What is a pediatric gastroenterologist? Simply put, she studies the science of unhealthy guts.
We are a group of doctors that take care of digestive and nutritional issues in children. So we take care of children from birth to approximately the age of 18 to 21. We really don't have any hard cutoff age. But generally speaking, we take care of children with belly pains and constipation and diet-related diseases. We counsel on nutrition and healthy eating practices. So just about everything from head to toe, because it is impacted by diet and gut health, we take care of a broad spectrum of conditions in children.
And so gut health is very important because with your gut, I mean, that's your immune system.
75% of our immune system is in our gut, yep.
Oh, wow. So talk to us a little bit more about what you have seen in your years of practice of children. Well, they're going to one day be students.
Yeah, they are students. Yeah.
They are students in some ways, but with them just like being ill, related to like their immune system and like how you saw it being related directly back to their gut.
Sometimes we see actually acute infections and we see how the gut plays a role in fighting off that infection or being inflamed or working through that infection. And a lot of times what we also see is autoimmune diseases of the gut or started in the gut because of an infectious process or some dietary change. So we take care of autoimmune diseases like celiac disease. We take care of Crohn's disease, which is a chronic inflammatory bowel disease.
Do you actually see Crohn's disease in children?
Fortunately, yes. They say about a quarter, 25% of actually inflammatory bowel disease, Crohn's disease, and colitis actually gets diagnosed in childhood.
I did not know that. You hear a lot about Crohn's, but I hear about it normally with people as they age.
Yep, 25%, unfortunately, and the peak age is sort of mid-teens.
Mid-teens.
Yeah,
so
12
what
to
happens
15.
when you don't diagnose that?
Children can become quite sick. I mean, we really do think that when children unfortunately get this disease, they usually get the worst form of it. They get a pretty aggressive form. So children who aren't diagnosed are getting sicker and sicker day by day. I mean, it's very rare to see a child go more than 6 months without a diagnosis because their symptoms get so strong. They're losing weight, they're having fevers, they're having blood in their stools. So it is very important to make that diagnosis and get them on the right path.
And so tell us a little bit about like what has been like one of the most extreme situations you have seen with a child come in underneath your care.
We've seen children like present in the emergency room where their bowels are obstructed because of perhaps Crohn's disease or some other chronic process, and they've gotten so sick and nobody has picked up on it that they end up in the emergency room, and then a CAT scan or X-ray or something will show that something chronically has been going on, and then we get consulted, we start taking care of that child. We may do a colonoscopy or an endoscopy, and then find out, oh, this process probably started 3 or 4 or 6 months ago, and it's led up to this devastating consequence.
And so once they get to that point where they have to have surgery, like what is the recovery like, and like can that child have a quote unquote normal life?
Yes, the good thing about, there's so much advances in modern medicine between pediatric surgeons and pediatric gastroenterologists and the availability of new medications. Most children do extremely well. We get them on the right medications. They're extremely resilient, which is one of the reasons I practice pediatrics, because most children are just so resilient. They just need a little help, a little push in the right direction, and they do just fine. So very few children, fortunately, are impacted in such a dramatic way. You get them started on the right medication and they do just fine.
And I understand that your husband's also a pediatric doctor, and you said he's more on the surgical side.
He's on the inpatient side. Okay. He's what they call a pediatric hospitalist. Okay. He also works at Swedish, and he takes care of children who are admitted to the hospital.
Okay, so what does that look like?
Children who are admitted after surgery, or they have an asthma flare, or they're admitted because they need their gallbladder taken out, or they have appendicitis. They're usually short stays for the most part.
So he's more of a generalist.
General pediatrician, right, that takes care of the acute problem in the hospital.
So what are your conversations like at home?
Well, we both love children. In fact, that's the reason we both became pediatricians. It's funny because when we first met, we thought, wow, we were talking about how come you went into pediatrics. And we went into pediatrics because of our love for children. I had decided if I didn't get into pediatrics, I was going to be a teacher. There was no other field in medicine for me. It was pediatrics or nothing. Same with him. So we talk about patients because we love our kids that we take care of, and we'll talk about, oh, I got to pinch the tummy of a 4-month-old today, and there was this little baby in a daisy dress or a polka dot dress, and we talk about all these children that we met and how, they help us, I think, feel happy at the end of the day, because what job could you do that's more transformative than go to work, help children feel healthier, and then come home at the end of the day? It's the best feeling in the world.
I can imagine it.
I mean, I get paid to do this. I sort of pinch myself that I get paid to play and take care of children every day.
Wow, that has to be really amazing.
It's amazing.
And so you mentioned it, so you're a specialist. So pretty much, so your patient is not like just me walking through the door with my daughter to come to see you. Your patients are usually referred over
Usually.
to you.
You could just decide you wanted to see a pediatric gastroenterologist, but most, I'd say 90% of the patients that come to see me are because they have an issue, the pediatrician feels like this takes a specialist to sort of answer, and so then they write a referral and call us or tell us to see this patient on their behalf.
Gotcha, okay. And so what would you say to parents? I mean, parents that have children, and maybe you hear certain things like, oh, my tummy hurts. And if you start to hear that more regularly, what would you recommend to those parents?
I would say if a child is complaining of, frequent belly pain more than 3 or 5 days a week, and this has been going on for at least a month or 2 months, this needs to be addressed. It doesn't necessarily mean that it's something dangerous or serious, but at 1 or 2 months into this, it's something you need to definitely mention to the pediatrician. And pediatricians and pediatric gastroenterologists, we have a series of questions to ask to know whether this is something we need to act on or sort of reassure the parent and say this is a sort of a normal tummy ache and it's a phase and your child will get through it. But it's something you need to bring up.
Okay.
If it's gone on for more than a month or 2 months, yes.
And so if you can help some parents, especially some new parents, like what are some of the signs outside of, oh, my stomach hurt, especially with young children, because when they're under maybe 4 or 5, sometimes they're not really, they're communicating.
They can't even tell you if it's a tummy ache or they're hungry or they
exactly.
need to poop.
Yeah, they need to poop. That's true. Sounds like my 3-year-old. So what would you say to those parents, like things that we should look for or watch out for?
So usually if the pain is severe enough to cause them to cry or stop doing the things that they would like to do, it makes them not want to eat. It's waking them up from sleep. It's associated with other symptoms. So we have sort of the rule of ones in pediatric gastroenterology. If it's one symptom, just pain, the longer it goes on without affecting anything else, the less likely it's something serious. But if this pain is now causing them to also intermittently vomit, they're losing weight, they're having fevers, they're having some diarrhea, there's another symptom and another symptom and another symptom coming on, then it's something to make sure it's not a sign of another disease. But the longer a child goes with just my tummy hurts, but I want you to know, mommy, and then I'm going to go off and play, and that's the kind of bellyache, and it's been happening every day for a few weeks, probably less likely to something to worry about.
Okay, gotcha. That's good to know. That's good to know. So talk to our viewers a little bit about the difference between treating and preventing.
This is actually one of my passions, because as a gastroenterologist, I've always thought like, wow, I wish I had seen this child 2 years ago before this had happened, and how could I have prevented the child from becoming constipated or developing Crohn's disease? And there's so much science now to show the onslaught of autoimmune disease and chronic metabolic diseases that we're seeing in children that we once upon a time ago only saw in adults is happening because of the toxins in our environment and the processed food industry and the sugar that we're exposing our children to. So one of my passions is to teach parents of newborns and infants on how to introduce those new foods, to avoid sugar, to make their foods at least as much as possible, avoid the ultra-processed things, the heavily processed foods, because these are the things I think over time damage our gut and lead to autoimmune diseases. And by eating real healthy natural foods, the way our grandmothers and grandfathers would have recognized food as food, we're going to get more fiber, we're going to get more prebiotics and probiotics and vitamins and phytonutrients, and we might be able to actually make an impact in preventing disease for the next generation.
Wow, you're absolutely right about that, especially when I think like my grandmother still has a garden in her backyard. And I'm like, wow, that's so amazing. And for me, I've never necessarily have had a garden, and been able to cook my food that way. And it's very important if we expect for our next generation to be healthy, right? To be able to work, to be able to.
There are children I meet now, and they don't really know the concept of eating something that doesn't come out of a package or a box.
How does that make you feel as a doctor?
Very sad. Very sad, because I'm starting to understand the reason I'm seeing children who have these diseases that I never thought I would see as a pediatric doctor is because of this change in our diet. I think our diet is linked to a lot of disease.
And so talk a little bit more about that. That's huge, right? Because I mean, diet, we're that's impacting everyone, not just children. So what do you recommend that we do in our households, in our schools, and just in general, in our workplaces, to be able to combat some of this processed food, and some of the things are out of our control, in all honesty.
Yeah, so we're not all going to have the luxury of baking our own bread and having gardens. What I tell parents is, when you have to choose something that comes out of a package or a box, try to limit the number of ingredients to less than 5 or 7. Learn to read that nutrition facts label. See if there's a lot of those words that you can't even pronounce. You know that those are chemicals just by the sound of their name. Avoid that and go to the next food on that shelf and see if you can find something with more natural, easy to pronounce, ingredients. And then the one thing I want parents especially to avoid as a listed added ingredient is sugar and emulsifiers. So emulsifiers I'm passionate about because emulsifiers are foods that basically make oil and water stick together. Emulsifiers are added to a lot of processed foods, but we have good scientific data now to show that they emulsify the lining of the gut. So they can actually cause sort of inflammation, and this can set you up for later on chronic diseases like autoimmune disease like Crohn's disease.
And what other diseases? When you talk about inflammation, that becomes very serious. Inflammation can lead to many, many, many things.
Yeah, inflammation can cause later on autoimmune diseases, allergies. Inflammation can lead outside of the gut to autoimmune diseases in the joints, in the skin.
Arthritis. Yeah.
There's links between this sort of chronic inflammation and cancer, heart disease, dementia.
It's a pretty serious thing.
And if it started because 20 years ago you were eating a food that contained these chemicals or emulsifiers or too much sugar, what a lifetime of change we can produce by teaching these children early on to sort of watch the ingredients, read that nutrition facts label. Just because it's sold as food and it comes out of a package, we don't really know what's in there.
Yeah, that becomes very scary, and we definitely have to educate our children. I think I mentioned to you I have a 3-year-old, and last night she would not go to sleep, and she didn't have a nap, and she was up for like 12 hours. And I couldn't figure out for the life of me, like, why was this child not go to sleep? She kept saying, "Mommy, I'm tired, I'm tired." And every time I put her down, she was fighting me. And then it hit me this morning, like, I gave her a piece of cake for her birthday.
And I bet she's not
at
used
5
to eating
p.m.
that.
And she's not used to eating that whatsoever. She's definitely not used to eating that.
Yeah.
And she did not go to bed till almost midnight. And so, I mean, as a mother, not only did that impact her, it impacted me because I didn't get sleep.
What impact diet has on our life, right?
Yeah, absolutely. That's exactly what it showed me. It's like, this is very serious. So I saw it for myself personally, the impact. And this was a child that was breastfed for 2 years, and she was eating avocado up until she was like 1.5, 2 years old, just eating it raw.
Wow.
Yeah, she had such a great diet, beets and everything. However, I must say I'm struggling now that she's 3 years old because like she can kind of pick and choose, and she had some of the McDonald's nuggets and things like that. So what would you say to a parent like myself that did very well that first 1.5, 2 years and kind of fell short the last year? Like, how do we get these
You haven't
back on
fallen
track?
short. This is a very common phase, the 2 to 3 years old child who's exploring and finding out new foods. Those flavors are so overwhelming to them, those flavors of the processed foods. It's extremely addictive, those foods, and it's hard to get them back to the good, natural food flavors.
Yeah.
But provided that you support them and you don't pressure them, they will come back to eating the way you taught them as a child. And as long as you're setting a good example, and those aren't the foods that they're surrounded around, by at home, they're going to probably follow your example long term. There's no way a parent can win a food fight with a child, a toddler.
Yes.
So let them explore, let them learn about that. They'll go through a phase of 1 or 2 years of being extremely picky, but as long as you have enough experiences and flavors at home that are healthy for them, they will come back to their roots. Yes.
Good, yeah, because that piece of cake, she was off the walls yesterday.
They'll learn. You set a good example at home, and they will come back to their roots. Yes.
Well, thank you. I have a little bit of hope. So talk to us a little bit about what made, so I know you said you and your husband both said you love children, and that's why you both became pediatric doctors. But like, what was that first moment when you knew, I'm going to be a doctor?
It's ironic. So when I was a medical student, we went to the delivery room, and I was actually in my OBGYN rotation, but I think after the mom delivered, I was more focused on what they were doing with the baby. And that's actually, a senior told me, see, you were more interested in the delivery and the baby and what the neonatologist was doing with that with the baby in the room. You weren't really caring what was happening to the mom. I think that was your sort of moment to know who are you more passionate about, the child or the mother.
And so it was this child for you.
Yeah, made it for me. I knew that this was what I was in medicine for. Just love children. I have more empathy for them. I know that they don't have a voice. They have to raise their hand a little higher, and they have to speak a little louder. And I feel like we as pediatricians, we can be their advocate. We can be their voice.
Absolutely. And so when you think about like the future generation, what would you say, why is it so important for women to be in the medical field from a representation standpoint?
Because we impact, I think if you can teach a woman how to take care of a community, we have a stronger voice, we're more nurturing, I think we have more empathy, and we can set an example for the whole household. We are the mothers, we are the caretakers. We can impact a child's future, I think, better than anyone else in the society.
And so how do we get more, so of course there's definitely female medical doctors, but there's a big push to get more women into like STEM careers, and I know that medicine is not necessarily, it is though, it's science. Yeah. So what would you say, what are some of the things that we need to do as like a educational system and as a community and families and parents to be able to shine a light more onto science and girls?
Programs like what you're doing here, highlighting the women that are in medicine and scientific careers, sets an example for the children. I think it's also important to get children out into nature and experience biology and chemistry. And it's, really math isn't important for medicine necessarily. It was my passion about biology that got me into medicine. So to teach them those biological and physiology and chemistry, those sciences early on, would get them interested in medicine.
Awesome. And what would you say to that future generation about what it takes to be an influential woman?
Study hard. Never underestimate your potential. Never let anyone say no to you. And keep following your passions and dreams. If you work doing what you're passionate about, it never feels like you're actually doing a job. You're going and doing what you love, and you're coming home happy.
Those dreams that you have, nurture them. If they're not finding soil right now, don't throw them away, because you never know when that person's going to show up. That happened with me. You don't know when that person's going to show up, who's going to give you that boost to get you to the next level, and keep searching for that person.
Nice. Okay, Ben.
As an ally?
As a male ally.
Who?
So you're talking to both, you're talking to everybody, the kids.
Yeah. So a lot of it is about this concept that you talked about, that there's a different voice in young people.
Yeah.
And that it really is about, we expect a different world. We're not just saying, oh, this world is all we can hope for. We expect a different world, and you better get with us to help us do that. Yeah. And I want to just keep encouraging that. I don't want someone coming out of college to lose that sense of expectation that their dreams are exactly the way the world should look. I think that's beautiful, and I want to make sure that's held high.
Yeah. My advice would be to go into any situation like you own it, really, you are, someone who struggles with that. I think I influence in smaller ways, and I want to continue to do that. I always want to look back at the people who have helped me and bring that forward. And anybody that I help or look to influence in STEM, I'm always like, who are you helping? It's very important that you're always looking to the next person to give what you are receiving. So I think in influence that it would be always give just as much or more than what you were receiving.
Wow. Ooh, that's powerful.
Wow. I would say that I think that there's still some real, very basic things about men and women and how they approach what they want out of life. Some of the things that we've learned about hiring, for example, that if you put out a job posting, you'll get male applicants who in no way meet the qualifications on the paper, but they figure, why not? Why not me? to borrow a phrase from one of our favorite athletes. And then, but women, and I've done this myself, will look at that and read every single, I don't have that one, I'm not qualified. So we disqualify ourselves. And I think we still see that. We hold ourselves to the highest standards. And so I would encourage women to just give it a try. Say, why not me? I don't think there's anything wrong with saying, why not me? Put yourself into the mix for something that you think you might be able to do or want to do. And at the very least, you're going to have an experience and you're going to learn more about what it would take to get to where you want to go. And you'll meet people, some of those people who will become your mentors, some of the people who will help you to get where you need to go. And I think that's so important, to put aside that voice in your head that says, I'm not ready. There are things you're just never going to be ready for. Do it. Just do it. And you're going to hear no a lot, but hopefully you hear no, but, as opposed to just no and then keep moving on into the future. I think that's something I wish every young girl would really embrace, that they can do things and they should assume they can do more than they think they can.
And so what else would you like to shine light on if you're speaking, like right now, if you had 1 million parents sitting in the room with us right now, you were able to give them one piece of advice, what would that piece of advice be when it relates to their children and their GI tract?
Never underestimate the power of diet, not only to prevent disease, but also to treat disease. That food really can be medicine. And I think we underplay the role of diet and nutrition, especially in MD medicine, modern medicine. We sort of think, eating is just for calories and for sustenance, but when you develop a disease, we use medication. We forget the importance of diet from birth throughout childhood as a way to actually teach the body to prevent disease. So I think parents really need to be explained what is food, what is not food, what are the ingredients in food that are anti-inflammatory, prevent cancer, prevent autoimmunity, and to teach parents how to teach the child how to choose the healthier foods.
I think you hit on something that's very key that I hope everyone heard, that you said to teach the body how to prevent disease. Yep. That's very key. And I think that's the piece right there that really, that's the beginning of building that tool belt for parents and for children, so they can know how to be able to be healthy and prevent those diseases.
Yep. There are children I see who come in because they have chronic abdominal pain or nausea.
Yeah.
And I could just run a bunch of tests or prescribe an anti-nausea pill, but a lot of these children, if you go and spend 45 minutes and look at their diet, they're drinking a can of soda every day. You take away that soda and their belly pains and their nausea go away. Yeah. So what is happening with our diet has to be explored a lot more. And I think that's the biggest take-home point that I've learned as a gastroenterologist.
I have 2 more very important questions, being a mother to young children. Dairy, milk in particular, I mean, that's pushed a lot of times when you're having children. And my daughter never really took to cow's milk at all.
I think drinking milk is a little overrated, actually.
Yeah.
I mean, if you think about it, I say this sort of jokingly, we're, as the human species, the only species that drinks the milk of another species.
That is kind of awkward.
Right?
When you think about it.
So milk, dairy isn't absolutely essential. If you think about it, they grew up sort of drinking a white liquid. They were breastfed or they were drinking formula. So naturally, we just transition them over to something else white. But if they drink water and eat good food, there's nothing wrong with that. As long as they get some calcium and protein, which is basically vitamin D, which was what they were maybe getting from that dairy, in another source. And there's plenty of other foods that would give them vitamin D and calcium and protein. They don't have to drink this white liquid.
And so what are your thoughts on vitamins with children?
I think the best vitamin is your food.
Yeah, I knew you were going to say that.
The only thing, especially in the Pacific Northwest, that's really hard to get enough of is vitamin D. So that's probably the only one thing I routinely prescribe. It's a supplement is vitamin D.
Vitamin D for children. So not necessarily the multivitamin, just vitamin D.
Just vitamin D, yep.
Okay.
If you can get all the other micronutrients through your diet, it's probably more bioavailable, more absorbed that way. But vitamin D is just hard to get.
It's just hard to get, yeah, especially out here with all the it's not
lack
really
of
the
sunlight.
Yeah, it's not even really the rain. It's more of the overcast. That we have out
and
here.
especially dark-skinned people like you and me, we don't absorb it. So
Yeah,
we need
we
extra
absolutely
vitamin
need
D
it.
supplements. Yep.
That's true. So one other question: when children have to take antibiotics due to other maybe diseases that they have, what do you recommend for them gut-wise? Because, of course, if you're taking an antibiotic for any long
Yep.
period of time,
It
that's going
affects
to
your gut,
directly
yeah.
impact your gut.
Yeah, your gut, they say, is really just bacteria.
Yeah.
You have more between the bacteria and the genes of the bacteria, you're more bacterial than human in your digestive tract. So every time you take an antibiotic, it can affect your gut. So I tell kids at that time, especially to take maybe a probiotic supplement
Yeah.
or to eat more fermented foods. Fermentation increases the probiotics in our diet. And to eat more fiber, because fiber then feeds those gut bacteria and they last longer in our body.
Okay, good to know.
So yogurt or something like that.
So yogurts, okay, good,
yeah.
very good. And so I wanted to know, I've been sort of playing around with this idea in the creation of this TV series about women having a seat at the table or creating their own table, or a combination of both. What are your thoughts on that?
I think the voice of a woman always needs to be heard, especially in medicine, especially in pediatrics, because I think we have more of a nurturing attitude and more empathy. Without the voice of a woman in healthcare and medicine in general to find that nice work-life balance, to understand what are families going through, what's the impact of diet, how do you go shopping as a mom, all of these aspects, I think it's very important to have the voice of the woman at the table.
Thank you for joining us in our exploration of science. We hope you're encouraged and inspired by Dr. Uma and women like her, leading in medicine across the nation. Join us for future episodes of Influential Women of Washington State to hear more discussions from extraordinary women. Until next time, I'm Katie Hall.